Good afternoon, and welcome to today's webinar, the BCERP Legacy, Windows of Susceptibility to Environmental Risks of Breast Cancer. My name is Michelle Dixon, and I am the Program and Development Director for the Massachusetts Breast Cancer Coalition, and I'd like to thank you all for joining us today. I am very pleased to welcome today's speaker, Dr. Gwen Collmen. As Acting Deputy Director of the National Institute of Environmental Health Sciences, Dr. Collmen helps to drive the formulation and implementation of plans and policies necessary to carry out the NIEHS mission. For the past 11 years, Dr. Collmen has been an active member of the executive leadership team in her role as the Director of the Division of Extramural Research and Training, known as DIRT. During this time, DIRT has developed many new areas of research support tied to the NIEHS strategic plan. Dr. Collmen has directed scientific activities across the field of environmental health sciences, including basic sciences, organ-specific toxicology, public health-related programs, and training and career development. She also oversees the implementation of the Superfund Research Program and the Worker Education and Training Program. She is credited with building the NIEHS grant portfolio in environmental and molecular epidemiology, and she developed several complex multidisciplinary research programs, including the Breast Cancer and the Environment Research Centers program. Dr. Collmen, welcome.
Thank you so much, Michelle, and my thanks to the Massachusetts Breast Cancer Coalition for inviting me to be part of this webinar series today. I'm going to see if my slides move. No. So, whoops. Okay, here we go. So I want to start with a little bit of a personal history. So the first time I was introduced to the Massachusetts Breast Cancer Coalition was back in 2001. And you'll see from this slide, this is the title of a talk I gave to your membership at a meeting in Boston, Breast Cancer and the Environment, Fitting the Pieces of the Puzzle Together. So that was back April 23rd, 2001. So we're almost on an anniversary here. And I understand it's the 30th anniversary of the MBCC, so congratulations to all of you. So let me say that lots have changed in the years since I last spoke to you. Back in 1997, little was known about environmental causes of breast cancer, but there was an important paper that was published in the Annals of the New York Academy of Sciences after some convenings to talk about this. So back in the 90s, it was well accepted that hormones have played a very critical role in the development of breast cancer risk. And in the 1997 paper, Deborah Davis introduced the concept that certain environmental chemicals, including plastics, pesticides, fuels, and drugs, can disrupt the hormones production and metabolism. And endocrine-disrupting chemicals or endocrine-disrupting materials were generally found widely in the environment. And there was just the beginning of this sort of glimmer of thought that perhaps these chemicals could also be related to breast cancer risk. Well, fast forward a number of years, lots of research done on this topic through the Breast Cancer and Environment Research Program, which I'll tell you about, but in other research laboratories across the world. And in 2017, Gray et al. Publishes in Environmental Health, the state of the evidence to that time, an update on the connection between breast cancer and the environment. And she says, increasing evidence from epidemiologic studies, as well as a better understanding of the mechanisms that link toxicants with the development of the mammary gland and the development of breast cancer, all reinforce the conclusions that exposures to these substances, many of them are found in common everyday products and byproducts, could possibly lead to increased risk of developing breast cancer. And in 2019, our most recent cohort of grantees in the Breast Cancer and Environmental Research Centers program writes a paper in breast cancer research that puts it on the map that environmental exposures during specific critical windows of susceptibility in mammary gland growth and development does create a susceptibility for breast cancer later in life. And she says with her team, the influence of environmental chemicals on breast cancer risk may be greater during several windows of susceptibility, including prenatal development, puberty, pregnancy, and during the menopausal transition. So today I want to just spend some time talking to you a little bit about this program that we developed many, many years ago, the Breast Cancer and Environment Research Program, and a little bit of the legacy of contributions that the many investigators have made and some of the unique attributes of this program. You may know, I imagine you all know, that this is a one-of-a-kind program which brought together researchers from the fields of mammary gland biology with epidemiology and clinical scientists, but most importantly, brought those scientists together with the advocacy communities, both at the local, regional, and national level, in order to form teams that would work together on these important issues. And the kinds of contributions that were made over this 20-year period include better understanding of the biological mechanisms involved in breast cancer, understanding how our genetic, environmental, nutritional, and social factors affect risk, understanding how these important windows of susceptibility may play a role, both in the timing of exposure and the impacts that those exposures have, and determine effective ways to engage and educate girls and women about these environmental factors, as well as breast cancer risk and also the puberty trajectory, and in order to develop meaningful partnerships to advance breast cancer prevention. So I can't go through all of this, but I'll flash this up on the screen for a moment so you can sort of take in the breadth of activities that have been going on in this field since 1994. I'm happy to say that I've been involved in almost all of them, not every single one, but many of them, and had the opportunity to work with amazing women and advocates for breast cancer prevention across the country. Without the input of the breast cancer advocacy community, especially those of you who are particularly interested in environmental causes of disease, a lot of this work could never have happened. And certainly the impact and reach of this work would never be what it is today without all of the partners working together. So let me just tell you a little bit about the framework and how we conceived of these ideas. Well, as I said, it was critically important for researchers across a variety of scientific spectrums to work on these thorny problems. And we were very much committed to community outreach and translation, and we created the first phase of the program so that we had one set of projects that dealt with mammary gland biology and basic sciences that could include toxicology studies of one form or another, dosing young animals during pregnancy or early in life, during puberty or in later life, and then looking at the impacts of those chemicals on the mammary gland, counting cancer tumors in the breast, in the animal models. And then a very unique project, three of the centers that were created had cohorts of young girls who had not yet started the puberty journey, and they brought them into the study. They measured a lot of factors, including collecting biospecimens from these girls, so that they could measure environmental chemicals in the biospecimens to look at the interactions between a variety of environmental and social characteristics that would occur over the pubertal trajectory. They measured, through clinical exams, they measured the breast development using standardized tools and clinical methodologies, and they also did sometimes every 6 months and sometimes every year very formalized questionnaires and biospecimen collection in order to create a big repository of data and specimens in order to test these hypotheses. Phase 2 and 3, which started in 2010 and went all the way to 2020, and some of the grants in the third cohort are still active as they're finishing out their work, created transdisciplinary teams, meaning that the researchers in the phase 1 were informing each other about the work that they were doing and trying to move forward answering questions. But in phase 2 and 3, they were creating questions that took a different perspective based on the different disciplines of the investigative team. Also listening very carefully to the input of the advocates at the table so that the work that they would do would be enormously relevant and be addressing the concerns that the communities had. We added a coordinating center to help us with cross-collaboration, to involve a lot of committee infrastructure and steering committee work, as well as facilitate the dissemination of the work to a larger audience. So as I said, there were 3 phases, and they really had a bit of an evolution. We started with this epidemiologic cohort study. We had a variety of animal work, which featured looked at the molecular features of the mammary gland. Back in the days that this program started, there really wasn't even much known about the mammary gland during puberty, and the work that we've done really helped to inform quite a bit of the science in that regard. Phases 2 and 3 really evolved into this transdisciplinary program, really focusing on these windows of susceptibility. We started our first phase really focusing on pubertal timing, but we expanded the program so that we wouldn't miss important research that was done at other windows of susceptibility. And then in addition, we also had a communication research initiative from 2016 to 2018, because there was a lot of really interesting work that was coming out of the program, and we wanted to package it in ways that would meet the messaging needs and provide a sort of toolkit of messaging and different strategies that could be used by our advocacy partners to move the research out of the bench, out of the journals, into the hands of those people who were particularly interested in knowing about it and would be in a position to think about it from a prevention standpoint. Here is a slide. I love this slide. And let me also say that the data here is from a couple of years ago. I gave this talk at our final in-person meeting for our BCERP grantees. And so the compilation of the number of papers and the reach of the publications really is a bit old at this time. And unfortunately with COVID, we didn't really have the manpower available to update these slides, but just let it be known that 363 publications is a pretty good yield from a program of this size. And even today, there's even more papers that are published. But more importantly, the information that's in these publications is really moving out into the community and being given to the people who need it most, so that they can understand the risks that are associated with environmental factors. We've also generated quite a number of scientific resources that are used within the breast cancer community at large by our repositories, focusing on data harmonization from our 3 human studies. There are several animal models that we'll sort of show you highlights about. There was some technology advances to be able to measure breast density in new and alternative ways, and a lot of statistical work to be able to analyze all this data that came out. The expanded toolkit that we have, which is also available on the program's website, has fact sheets and brochures, and there's all kinds of videos and different monographs, coloring books, materials that help the children that were in the study stay engaged, and other ways to provide this information in a sort of health education mode that really reaches multiple kinds of diverse communities so that they all have the benefit of the findings of the study. So I'm just going to flash this up here quickly. This is a big data approach to the topics that are in all of our publications. You can see many of them are about the mammary gland. They focus on a variety of different chemicals that we focused on. The windows of susceptibility related to pubertal development, a lot of work done in different types of breast tissues, looking at the breast cancer, breast tumor type subtypes, gene expression, and DNA methylation. All of this incorporates the toxicology work that we did, looking at a suite of chemicals that were part of the important work that was done in this program. Again, I just will put out there the windows of susceptibility framework, because I have the next number of slides organized in a way that systematically goes and talks about research highlights by different windows of susceptibility. So you can just get a taste of the kinds of work that was conducted over this 20-year period and that has made a big difference in our knowledge. So I'll start with the prenatal period as a window of susceptibility. So lots of work in our program was focused on these endocrine disrupting chemicals. And in the early phases of the work, we dosed animals and looked at their mammary glands through the developmental process to see if we could see tumors or early changes in the cells that would indicate tumor risk. And so here we have some examples related to BPA in the literature, and we also used opportunities to look at even alterations in genes relevant to breast cancer in daughters in a human study that was published in 2019. So again, looking at epigenetic marks related to DDT exposure, which is one of the earliest synthetic endocrine disrupting pesticides that we are aware of. And there's lots of work through our program looking at these chemicals of interest. Pre-puberty and puberty as a window of susceptibility. Well, again, remember I said we invested heavily in studying girls going through puberty, and we looked at a variety of environmental chemicals, so phytoestrogens, phthalates, phenols. We looked specifically at subgroups. Some of the groups of girls in these studies came from diverse backgrounds, so we were able to look at racial differences. And here's a paper that was focusing on the social environment and also access to recreational outlets and parks as a part of the web of risks that might be associated with pubertal onset. We noted that the distribution of pubertal timing had shifted to a younger age from the past literature, and we were able to document that in our study. And we also looked at perfluoride chemicals that were found in the blood of the girls in one of our cohorts, and we saw that breastfeeding was also associated with that. So some more work here in pre-puberty and puberty as a window of exposure. Delayed pubertal onset was associated with some of the organic compounds, the persistent organic compounds. We saw that diets that were high in fat were associated with higher risk of breast cancer in animal models. We looked at biomarkers in the girls, different hormone levels, and the levels of amphiregulin as a signaler to the breast tissue, and they may be predictive of increased breast cancer risk later in life if you can see those markers in pubertal girls. And then also faster epigenetic aging was associated with faster pubertal development, and this may also be an early marker of increased cancer risk if we can follow these studies into adulthood. So this is a summary slide. Lots of chemicals to think about that were in our program, and as I said, the pubertal time frame was really an important area of concern for us. So if you think about the model of what we were doing here, and how does pubertal timing even affect breast cancer risk? So if you think about the amount of time that the breast tissue may be exposed to varying levels of estrogens and progesterone based on menstrual cycle and the number of years that people are actively ovulating. You're also thinking about when breast development occurs and what's that time period from when breast development then leads to, also you see pubic hair development, and then you see the first menarche in a girl as this early stage. Like, is this part of the trajectory an important factor in the number of years that the breast is exposed to these various levels? So another idea would be how the age from menarche to menopause. That's another very important window. And of course, as you might imagine, these time frames and tempos are very variable among different populations of girls to women. And then they were also interested in height as another marker of pubertal timing. So you can see, like, we all started with this hypothesis that an extended period of estrogen and progesterone exposure would be a risk. And we thought all the chemicals would act in the same way. But in fact, the suite of environmental endocrine disrupting chemicals that we became concerned about actually worked in different ways. Some of them created opportunities that we saw that earlier breast development, earlier pubic hair, and earlier menarche, and some delayed the timing for when breast development started. And so it's hard to wrap your head around all of this, but let it be just put out there that it's really important to think about these risks chemical by chemical, even though we know that girls are exposed to a mixture of these. So to continue with that thought process, we looked at adolescence and adulthood as another set of windows of susceptibilities. And we have a really important study that was done by Barbara Cohen and her team using a really valuable resource of a multi-generational study that was started in the 1950s, where exposures to DDT were high, and then they were able to follow up the adults that had been participants in the study as children to find that there had been a five-fold increased risk of breast cancer in women who were heavily exposed to DDT, as exemplified by the blood that was collected during that time, during childhood and adolescence. And women not exposed to DDT before age 14 didn't show this association between the later DDT exposure and breast cancer. So again, the timing of these exposures is really critical for estimating risk, and summarizing over a lifetime doesn't probably get you the whole picture of what's going on. And then there's been some animal model work here too that are looking at genetically distinct models and looking at ERB2 positive breast cancer, and as it is associated with bisphenol A exposure during that time. So pregnancy and postpartum, that's another critical part. If you think about when a woman is pregnant, she's not only exposing herself, but she's also exposing her fetus, and then also the important cells in the body of the fetus are also being exposed during this period of time. And so you can possibly, if you're able to follow cohorts of women that give birth to children that then grow up to become pregnant themselves, you can really follow multi-generational risks of these chemicals. And this study that I mentioned that Barbara Cohen is the PI on, the Child Health and Development Study, is a very, very unique resource that allows us to do this. So they've been also able to look at PCBs and to quantify breast cancer risk in the women who were exposed at various times. And then there's been complementary studies in mice. Many of them we were able to dose pre-pregnancy, during pregnancy, and postnatally, and look at the different risks associated during those time periods. And then as we age, we continue to have exposures to these chemicals over our adult life. And we're also interested in understanding how menopause might also be a window of susceptibility, as we know that there are different risks associated with risks for breast cancer in premenopausal and postmenopausal women. And there's not really been that much work associating chemical exposures during the menopausal trajectory, which of course is also has a tempo to it, when somebody starts going through menopause to when their cycles actually end. And then the postmenopausal time window for how susceptible the breast may be at that point. Really, the Breast Cancer and Environment Research Program was conceptualized, back in the late 1990s to think about this entire lifespan of risk that a woman might face, and for us to be able to create new data and new knowledge about all of these different windows. So let me switch a little bit to a lot of research that's out there, several hundreds of papers, 400 or more papers to date have been published. And how do we move that data? How do we take those findings and move them into usable information for the public, for women who might be at risk, for women trying to talk to their children about this, for the family members of the women who are at risk? What did our program do about that? Well, in the early configurations of the program, we had communication scientists, we had people in the journalism schools at certain universities, we had people who were researchers on trying to understand dissemination and implementation as part of our program. And they worked very closely together with the community advocates that were part of each of the centers to try to identify an agenda of this kind of work. And they did a lot of really interesting research looking at breast cancer news coverage, both in the public media outlets as well as, as time went on, more of this was online. They were able to look at how the scientific literacy of our community predicts whether the knowledge that's in the media online is taken up by the people who need it, and what do they do with that knowledge, and does that knowledge impact the perceived risks that they have for themselves or for their family members. We focused a lot during this time to focus on the data that was being collected in these studies, especially among the children, whether that data would be given back to the families. And I know that you know and have worked very closely with the Silent Spring Institute, and they've been really leaders in this whole movement to give data back on environmental biomonitoring to the study participants. And the Derby project has been part of the phase 3 of our center program. But even before Derby came on board officially, we had advisors from Silent Spring who talked a lot about report back and the need for that to be part of all of the work that we were doing here. So just kudos to this approach. Back when I started doing epidemiologic research on environmental health, we didn't return results to participants. We didn't have a way of individualizing and putting it in context and creating the impacts and providing additional information about what's known and unknown about the health effects, and even strategies to reduce exposure back then. So we've come a long way. I mentioned before that we generated quite a lot of scientific resources, and I mentioned these before, but let me also say that another partnership that came to be during this program was the opportunity for high school students from the Long Island area to actually go into the laboratories of some of the investigators in this program. It was really meant to develop human resources and human capital, get the students and the researchers of tomorrow interested in this area of breast cancer and the environment, and stimulate them to become part of this work. So I think that's also been a great resource that's been developed. So one of the resources, or several of the resources, have been animal-based, understanding how animal models, creating models that are appropriate, that signal on and off hormones at various times. We really need these kind of in vivo and in vitro models to explore the mechanisms by which both estrogens, but also estrogenic chemicals impact the breast at multiple stages of development. The translation and education, well, as I said before, we've worked very closely with many, many different groups: breast cancer advocates, environmental justice advocates, some of the national cancer organizations. These partnerships have been critical to the success of the BCERP. I mentioned earlier, we created an expanded toolkit, amazing, fantastic resources for all different audiences, for the girls and the families who were in our studies, for healthcare providers, monographs for pediatricians, grand rounds opportunities for doctors to become more aware, reaching out to oncologists, creating comic books and video series, and simple to use cards and charts that really give information, the nuggets of information about these environmental health effects in a way that's very easy for people to understand. This is one example. This was done by Zero Breast Cancer and the UCSF people, scientists, to look at two of them. They did one on this is the second one on breast density. They did an earlier one on pubertal timing. And these are just delightful. They're easy to read. The videos are very easy to understand. They really provide a resource and answer questions that community members have about clinical diagnoses that they get, or other scientific information that's out there as they're trying to understand their own personal risks. Advocates mentoring advocates. Well, advocates mentored a lot of people over the years of this program. They mentored me. I learned an amazing amount from women like the members of the Massachusetts Breast Cancer Coalition, working with groups in California, breast cancer prevention partners, Zero Breast Cancer, Huntington Breast Cancer, Great Neck Breast Cancer Coalition, and others that are associated with the other groups, the Pink Girls, and some other groups that were in northern Michigan. Just an amazing willingness to share your expertise, your lived experiences, hearing what it means for the advocacy community to be involved in these studies has been really transformational for me as a leader of this work and a facilitator of it. But it makes me feel really good to know that the work that the scientists have done is better informed because of the advocates being involved, as well as has had a journey outside of the scientific literature to the people who need it most. So this is just one example of a project that was conducted in New York City, where advocates really delivered programs in the breast cancer and environment sphere of information to women in Harlem, the Bronx, and Brooklyn, and worked with a variety of different advocacy groups that had not really been involved working with the scientists in the space related to environmental risks. These advocate groups in breast cancer had understood a lot about the medical care and the access issues and helping patients, but it was really switching and focusing on prevention related to environmental causes. Our groups here use every mechanism you could imagine to share this information, and this is just an example of a project where they partnered with mommy bloggers. So not just speaking to the breast cancer or the oncology community, but going to different routes to reach people, putting this kind of information in side by side with other healthcare information or other information that mothers need as they're raising their children, and here listening to them, as well as providing information to help them with disseminating the evidence-based risk messages that we've created around environmental breast cancer. Creating continuing education opportunities. There were some partnerships with Michigan State and researchers at University of Delaware, and I think this goes even beyond these groups, creating medical education, certainly around the environmental hazards. The PSHU units, the Pediatric Environmental Health units, I know have also done a lot of work, especially around these topics related to puberty. So, doctors are important in our healthcare, but they're not always as informed about these environmental health risks as they should. And our program helps to develop new curricula and ways for them to become more informed about this. So I'm gonna end by just talking about how NIEHS thinks about how this research starts and where it moves. We've created this translational research framework, and a lot of the work that we've done in the early parts of our program here were in the purple ring in the middle, and then we moved out. And so really to see true translation of the research that's created and the new knowledge that's created in a program like this, you have to move from the purple all the way out to the black. And then sometimes you start in the blue where you have some clinical practices or some observations that people make in the community, and you need to work back into the purple to understand more about the mechanism of effect and the timing of these exposures. So this is a framework that we are trying to promote more and more, because I think it creates a really nice set of ways to tell a story about the research that's being conducted. So I'll show you two quick stories, and then I will leave time for some questions. So using this translational framework, the research groups in Cincinnati discovered that there was PFAS, or perfluorinated compounds, in the water system in certain parts of Cincinnati. And the way they found this out was because they measured biospecimens of the girls that were in their cohort, and they found them to have higher levels of PFAS. And then they worked with the health department to trace it back, and they realized that the water system was a major source, the water supply was a major source of these exposures. And so then they were able to look at these exposures in animal models and understand how the PFOA compounds might stimulate the mammary gland. And then they were able to organize this information in a way which showed the human data as well as the animal hypotheses and data on that to work with the health system to think about how to reduce the exposure through water filtering. So very translational, starting with an observation in an epidemiologic study, moving to animal work, trying to figure that out, trying to understand the sources of exposure, and then working with people who are in the public health sphere and environmental health sphere who could actually do something about reducing those exposures in those water systems. Another trajectory that is really around the policy and practice area has to do, this is not necessarily work that was done specifically in our program, but it shows you the bigger effort over many decades of trying to identify these consumer goods and the products where these environmental exposures occur, the chemical exposures occur. Of course, the Breast Cancer and Environment Research Program tested for these chemicals in the blood samples of the girls, and so we were able to inform, and you can see, you can read through all of these different, dots in time. We were able to link lots of findings, both in the literature, but also in practice, related to policy, science, and practice. And then, of course, many of the chemicals have been voluntarily taken out of products because the makers of these products see that it's better to do that rather than to have to be regulated into doing this, and more cost effective for them to find substitutes or find other ways to create the products that they are using. So it's all within the context of understanding breast cancer risk. And even though we haven't had one individual study that starts from beginning to end to show that a chemical, when exposure occurs to when breast cancer occurs in a given woman or in a given population, there's so many different threads of evidence that really lead us to those conclusions. So with that, I just want to, this takes a village, as you all know, to launch these studies, and my work here was just a small part, but I led amazing teams, and we had a great collaboration with the NCI in this area, and we continue to work together with the NCI on this topic and broaden it to better understanding of environmental factors in all kinds of cancers, not just in breast cancer. So I think that's my last slide. And Michelle, if you want to go to the Q&A, I'm happy to stop talking and listen to the questions and see if I can address them.
Okay, thank you. Let's see. The first question that's come in is if you could speak to where you see legislation and advocacy going in terms of looking at chemicals in a one-off fashion, kind of the whack-a-mole approach, versus trying to attack groups of chemicals and their impact.
Sure, thanks. That's a great question, and it's a very, important observation. We know that we're not exposed to only one chemical at a time, and we know that our organ systems respond to many bad actor chemicals, but, there may be, as I showed you in that slide before, earlier in the presentation, there may be both, different directionality of the effects of chemicals on a given organ system. So it's very complicated to sort through the science to determine. I think we all believe that many of the chemicals that we've been studying don't belong in our products at all, and we'd be all in a safer environment if we didn't have any of them. And so, I think there is a movement afoot to think about things more holistically. There are programs like the Cancer-Free Economy Network that are really trying to look at chemicals from a source and supply chain approach, as well as understanding the health outcomes. And there are many advocacy groups, both environmental advocacy as well as disease-specific advocacy groups, which would, love to be able to work both with companies. I think that have seen a lot of that in the Safe Cosmetics campaign, and also, in the space of working directly with companies where we're making them accountable for their supply chains. We're just starting to really understand how to measure mixtures and how to really think about them. But I think PFAS is an example. The perfluorinated compounds, there's probably over 1,500 of them that are out there, and they have many different uses. And there's been a paper or two and lots of talks about this, suggesting that perhaps we should try to regulate all the PFAS as a single class of compounds as opposed to one-off, because it will take us decades to be able to measure all of those individual chemicals in our bodies and then do the toxicologic or the human experiments or studies necessary to really understand each of them individually. And really our goal is to just reduce exposure to all of them.
Thank you. I've got a couple of questions that have come in asking, I'm going to try and summarize this, essentially wanting your view on where the next frontier is in terms of research.
Well, I appreciate that question, and I don't know that I have a crystal ball. I do think that we're moving towards, and I know that our director here, Rick Wojtek, who's recently come on board, is really a fan of this approach. We all believe that the environment plays an important role in every single disease out there. There's been a lot of attention to personalized exposures, personalized health, understanding genetics. There's been great progress in identifying therapies in breast cancer and in other cancers, for particular gene or, epigenetic signatures, trying to understand all of that. But, if we don't include the environment in those investigations, and if we don't have ways to measure the important environmental mixtures, then the research is incomplete in my mind. We'll never really be able to know the whole story. So one of the things that NIEHS is really working on hard is to sort of create this suite of state-of-the-art techniques in order to do the measurements necessary, both in the laboratory and in the population studies. A lot of researchers in other fields don't know how to measure the chemicals that we're talking about, and we do. And so we're trying to create simple ways to explain why these factors need to be studied, as well as giving researchers the tools to study them, so that nobody can say in the future, well, there may be something to do with the environment, but I just didn't know how to access the methods and the ways to incorporate them in my work. So that's really a big push of our new director's philosophy towards future research opportunities.
Great, thank you. I'll give it a minute here for some additional questions, if anyone has one to type in. And I think this, you have touched on this. There are questions around the impact from an environmental justice standpoint, in terms of clearly certain communities are much more impacted by some of these environmental factors, given the nature of where they live and their economic status.
Absolutely. And, we thought about that, of course, through the Life of the Breast Cancer and Environment Research Program. But I think we as a nation over the last year have really stopped to think about this in a different way. When we started the 3 cohort studies, we wanted to make sure that we had a diverse set of populations included. So each of the sites had white girls, had Hispanic girls, had African American girls, and across the different study sites, we had a diverse population. But I think some of the things that we studied social determinants of health. We didn't forget about those, and we didn't exclude one set of factors over another. But I think today we think about these things in very, very different ways. I know that walking in the neighborhoods of many of the communities that I've had the privilege of working with, we've seen, and through this program, I've had access to these groups. I've seen the toxic legacy of the pollution that are in these neighborhoods. And I now think back to how I was listening to what they were telling me when we were walking. And I understood that it was a problem right now. But now I understand it to have been a multi-generational toxic legacy that was not only related to the having a chemical in your neighborhood, but it was the policies and the systems that created these areas of environmental degradation, and how, our society allowed all of this to happen. And so now, many, many years later, we are trying to just characterize our exposure in the moment, from a single urine specimen or for a single blood specimen. And it just doesn't do the problem justice, right? Because we have to be able to characterize the history. We have to be able to characterize the impact that the multiple years, multiple generations of discrimination, of environmental dumping, of environmental policy, of zoning issues has on the public health of these communities. And we need to think about that in in concert with how we think about lifelong breast cancer risk. So I don't have an answer to the question to say that, how the exposures are related quantitatively, but I do think that if you think about transdisciplinary research hypotheses around these questions, I think the questions that we will be asking today and in the future will really take into account a lot of the systemic racism and discrimination that these communities have faced.
Thank you. And I think you probably touched on what this last question that's come in, which was, if you were to do the BCERP again, what would you do differently?
Oh my goodness.
I know.
That's an amazing question. Oh goodness. So, if we were starting BCERP now, we would be starting from a place of more knowledge. One of the things that in the earlier days of the program, and I've been at it from the beginning, so I can say with certainty, we spent a lot of energy and time focusing on the fact that we had this big empty grid of all these chemicals that we were interested in and all these endpoints, and it was empty. And so the early days of the program were really filling in the gaps, going from a literature of a handful of papers to hundreds of papers. So now how would we design the next phase of research so that we utilize everything we've learned, but we ask new questions, right? I think we would start with bringing the community and the researchers together, just like we did back in, I think it was 2000, where we all sit down and say, what are the most pressing questions? And what do we need to do next to really see the impacts of the knowledge that we have created in the first phases?
Well, Dr. Collmen, I'm going to thank you so very much for your time today. On behalf of Cheryl Osimo, our executive director, and our board of directors, we are so grateful for all that you have done to support breast cancer prevention locally, nationally, specifically for our work. We are very, very grateful. And I want to thank all of our listeners today for joining us. I got several questions asking if this recording was going to be available, and it will be. It'll be up on our website later this afternoon, and you can find that at nbcc.org. So I wish you all a very good afternoon. And Dr. Collmen, thank you again.
Thank you for having me. I'm really sad that we couldn't all be in a room together so we could have a conversation face to face, but it's been a privilege to work with all of you and to know about the great work that you do in your state and across the country. And special thanks to Cheryl for her leadership. I really appreciate being part of your efforts. Have a great day, guys.
Thank you again. Have a good afternoon, everyone.